nothing beats the gut microbiome when it comes to complexity.
If there is an imbalance between this good and the bad, is what we call it as gut dysbiosis.
We need to be really conscious, we need to be really personalized in our approach for probiotics.
Most of the chronic inflammation comes from the gut dysbiosis.
When you start seeing terms like these in your microbiota testing or microbiome testing, is when you really know that you are looking at your microbiome and not your microbiota.
We're often taught that bacteria, viruses, fungi, and other microbes are harmful and cause diseases. While it's true that some microbes are pathogens and can make us sick, many are actually our helpful friends. These beneficial microbes, including bacteria, fungi, and even viruses, form symbiotic relationships with us and live in various parts of our bodies. One such organ where these microbes reside is our gut. In this video, we'll delve into the fascinating world of the gut microbiome. You'll discover its vital benefits, what happens when it becomes imbalanced, and practical solutions for restoring its health. So, stick around until the end to gain a deeper understanding of how these microbes impact your well-being. To grasp what a gut microbiome is, we first need to understand what a microbiome is in general.
So microbiome as a term is used to explain the collective population of microorganisms like bacteria, viruses or fungi which are living inside a particular environment. So let's say when I say gut microbiome, it actually means all the bacteria, viruses, fungi living in your gut. Now if I say oral microbiome, it's all about bacteria, fungi, viruses living inside your mouth. Similarly, there are multiple microbiome in our body. Even on top of our body, which is the skin. Skin is host to one of the largest population of microbiota as well. But nothing beats the gut microbiome when it comes to complexity. Why? Because the number of species and the number of bacterial cells that are living within our gut is pretty much twice the human cells itself.
Human cells number around 30 trillion, while our body hosts approximately 39 trillion microbial cells. As Professor Rob Knight from the University of California aptly puts it in an interview with the BBC, we are more microbes than we are human. Our gut, one of the most intricate microbiomes, is primarily home to bacterial species. According to scientific reports, our gut harbors between 300 to 1,000 species of bacteria, along with a few fungal and viral species. However, the term gut microbiome is often misunderstood. It's not just about the number of species present in our gut. It refers to a broader concept that is frequently confused by the general population.
There are two words. One is microbiota and one is microbiome. And there is a stark difference between the two. The first one, which is the microbiota, is actually a better word for what I have just explained. That is the total population of bacteria, viruses, fungi living inside your body. This is microbiota. When we talk about microbiome, things change a little bit. Microbiome is not the species or not the bacteria living inside you. It's rather what genes do those particular species have in present.
These microbial genes benefit us in several ways. For instance, bacterial species like lactobacillus, found in yogurt and other fermented foods, have genes that digest complex sugars and produce lactic acid as a byproduct. This lactic acid lowers the pH of the gut environment, making it acidic and less hospitable to harmful microbes while supporting our immune cells. But how do immune cells distinguish between good and bad bacteria? They do this through a process called pattern recognition. Immune cells identify microbes by detecting specific patterns on their surfaces. Harmful bacteria often have distinctive structures, like lipopolysaccharides, that alert the immune system to their presence. In addition to defending against harmful microbes, these beneficial bacteria also produce useful substances like serotonin, often referred to as the happy hormone. Around 90 to 95% of serotonin is produced by a bacterial species called Corynebacterium residing in our gut. This serotonin is then transported to our brain via the vagus nerve, which connects the gut and the brain. This connection may help explain why gut-related issues make us feel depressed and less happy. Moreover, our microbes assist in digesting plant-based carbohydrates such as cellulose, hemicellulose, and dietary fibers, for which we lack the necessary genes.
You might have heard that we should be eating a lot of fibers to maintain our gut. Why so? Because fibers are not food for you. Fibers are food for microorganisms. So when a particular bacteria eats the fiber or digests the fiber, they release this short-chain fatty acid called butyrate. This butyrate actually interacts with your intestinal lining and in fact helps your intestinal cells with energy to grow or to proliferate. That means that the intestinal cells can now grow properly and maintain that gut lining, which is very important.
The gut lining is crucial not only for absorbing nutrients during digestion, but also for supporting our microbes. It produces a sticky layer called the mucosal layer, which houses these microbes. In return, the microbes provide essential nutrients to the gut lining. However, when microbes are deprived of their food, they may start to consume the mucosal layer itself, causing it to thin. Dietary fibers, which are a primary food source for these microbes, come from fruits, vegetables, whole grains, and lentils. As our consumption of these fibers decreases, our gut lining can become compromised. Interestingly, research comparing populations from two regions, one being a tribe in Africa and the other from an industrialized country, revealed significant differences. The tribe, representing ancestral gut microbiota, consumed a diet rich in dietary fibers, while the industrialized population followed a modern diet with fewer fibers. The study found that the gut lining of the industrialized population showed signs of breach, whereas the gut lining of the tribal population remained intact. Our gut microbiome plays a vital role in maintaining the integrity of our gut lining, ensuring that only nutrients pass through and keeping harmful substances out.
जो पूरा gut microbiome है, that makes sure that आपकी intestinal जो permeability है, जो hollow pipe है, वो वैसे के वैसा ही रहना चाहिए. So it is also bound with tight junctions, which will make sure that the food or that anything that comes from that hollow tube doesn't pass that hollow tube, because when it passes the hollow tube is the concerning factor with inflammation inside your body. So this जो पूरा जो hollow tube का structure, the permeability maintained रहता है, it is because of your microbiome.
Not all bacteria in the gut microbiome support our gut lining. As we discussed earlier, some good bacteria that consume dietary fiber might start eating away at mucosal layers when they're hungry. However, some bad bacteria inherently harm the gut lining. These are known as invasive bacteria, with Salmonella and Shigella being well-known examples. Typically, the immune system and beneficial bacteria keep these harmful microbes in check. However, when the population of good bacteria declines due to a lack of nutrients or unhealthy food that favors bad bacteria, these harmful bacteria can overgrow, leading to adverse effects. Overuse of antibiotics can also reduce the population of good bacteria, causing an imbalance between good and bad bacteria. This condition is medically known as gut dysbiosis.
I would say there's an array trillions of microorganisms that live inside our gut. Now, there also has to be a balance of these trillions of microorganisms, because these are not only, I would say, good. There are also bad microorganisms that live inside your gut. So there also has to be always a balance between the good and the bad. If there is an imbalance between this good and the bad, is what we call it as gut dysbiosis, the imbalance between the good and the bad.
In healthcare terms, dysbiosis is described as an unhealthy or unbalanced gut microbiome. It can be characterized by a lack of beneficial bacteria, an overgrowth of harmful bacteria, or a loss of overall bacterial diversity. If left untreated, gut dysbiosis can lead to gastrointestinal diseases such as inflammatory bowel disease and metabolic disorders like diabetes and obesity. But how can you tell if you have a dysbiotic gut? One of the primary symptoms is constant bloating.
So that could be ranging from feeling bloating, and bloating is normal. But bloating, feeling after every meal that you have, and the symptoms keeps progressing over a period of time. Feeling that tightness. So most patients don't even understand what bloating is. It's that tightness you feel inside your stomach after you have that meal. So if this bloating is persistent with all kind of meals that you eat, it definitely is concerning.
In cases of dysbiosis, a reduction in beneficial bacteria, such as firmicutes, bacteroids, and Faecalibacterium, contributes to bloating. These bacteria are essential for the efficient breakdown of food particles. When their populations decrease, digestion becomes less effective, leading to undigested food in the gut. This undigested food can be fermented by other bacteria, resulting in increased gas formation. Another cause of bloating can be small intestinal bacterial overgrowth, where an overgrowth of aerobic bacteria in the small intestine produces excess gases like methane, carbon dioxide, and hydrogen. Another common symptom of a dysbiotic gut is acid reflux.
There are patients who have issues in regards to acid reflux post meals, specifically post meals, and they have been misdiagnosed for, I think, long period of time and calling themselves as, they have hyperacidity issues. These are problems who have maybe hypoacidity, or what we call it as hypochlorhydria inside their stomach.
Hypochlorhydria is a condition where lower concentrations of stomach acid are produced. Stomach acid plays a crucial role in maintaining a balanced gut microbiome by helping to ward off harmful bacteria, as demonstrated by the example of lactobacillus producing lactic acid. When stomach acidity is reduced, harmful bacteria can proliferate, leading to dysbiosis. These overgrown harmful bacteria may then produce chemicals that help sustain their dominance. Another major issue for patients with dysbiosis is unreliable bowel movements, which can manifest as either diarrhea or constipation.
There are patients who would have, obviously problem or consistency problem in their stool. So it could be diarrhea or constipation. So when we divide the gut function, if I talk about symptomatically, if there's a person who comes with a concern of acid reflux or something in regards to, post half an hour to 45 minutes after meal having the feeling of an acid reflux, it's majorly, compromised to stomach-related issues. If the patient has a bloating or a flatulence, I'm going to think more in terms of a small intestinal issue.
Other symptoms of dysbiosis include constant fatigue, skin issues like acne and rashes, mood swings, and even episodes of anxiety and depression. While these symptoms may be manageable with medical interventions if they occur for a short period, persistent symptoms could indicate chronic inflammation. Inflammation is the body's natural defense mechanism against infections and plays a role in healing injuries. When the gut lining is disrupted, a condition often referred to as a leaky gut, microbes and their secretions can enter the bloodstream and be treated as foreign molecules. In cases of chronic inflammation, these microbes can continuously enter the body, leading to ongoing inflammation. The problem with chronic inflammation is that, over time, its ability to distinguish between the body's own cells and foreign microbes diminishes. This can lead to the development of autoimmune diseases, where the immune system attacks the body's own cells. Chronic inflammation is also associated with metabolic disorders like diabetes and gastrointestinal diseases, such as Crohn's disease, and in worst case can lead to cancer.
Recently, I got a patient who had come to me with multiple systemic issues. I would say she had subclinical hypothyroidism. She also had problems in managing her blood pressure, so hypertension related issues. She also had an uncontrolled diabetes. She'd been taking medications for it for almost, I would say, 10 to 15 years for now. So now this patient, she'd done everything. She is managing all of these conditions, I would say individually, all by herself. But it has been 25 to 30 years, she's still facing the symptoms. It's not getting cured. Like I said, she's just managing the conditions every day and passing day. So now in this case, what I realized was there is a systemic inflammation, which is the root cause of all these correlating, I would say, systemic inflammations going inside. So in such patients, it's very important not to try and individually approach all organs. It's important to take in consideration what is the root cause, where the inflammation is coming from. Most of the chronic inflammation comes from the gut dysbiosis. So in this patient, eventually I realized that to manage and understand the gut and manage the gut dysbiosis is important because it was a driving factor of inflammation that was affecting all the systemic problems inside her body.
Gut dysbiosis is often considered a lifestyle disorder, meaning that our daily habits and choices can significantly impact our gut health. Poor nutrition, unhealthy eating, lack of exercise, and high stress levels can all contribute to an imbalance in the microbiome. By changing these habits, we can often reverse this dysbiotic condition. In cases of dysbiosis, the population of beneficial bacteria in the gut tends to decrease. To restore balance between good and bad bacteria, one effective approach is to introduce more beneficial bacteria into the gut. This can be done by consuming probiotics, which are supplements containing live beneficial bacteria, or by eating prebiotics, which are foods that nourish and support the growth of good bacteria. However, it's important to note that probiotics don't always work for everyone, and symptoms of dysbiosis can persist despite their use.
Why probiotics again never work in certain patients is if you're taking probiotics and your symptoms in regards to bloating and flatulence gradually increase over a period of time. That is because you're feeding the bad bacteria, they're growing and increasing your symptoms over a period of time.
Another reason probiotics might not work as expected is that each probiotic contains specific strains of bacteria, each with unique actions. Different strains are designed to address different symptoms. For example, the probiotic strain Bifidobacterium infantis has been shown to help reduce bloating and abdominal discomfort in some people. However, taking the wrong strain can lead to increased bloating and other dysbiosis-related symptoms, especially for individuals with compromised immune systems or underlying health issues such as gastrointestinal disorders or autoimmune diseases. It's crucial to understand what microbes make up your microbiome before starting probiotics. A microbe that benefits one person might be harmful to another. Therefore, probiotics should only be used after consulting with healthcare professionals who can provide guidance based on your specific health needs.
We need to be really conscious, we need to be really personalized in our approach for probiotics. We cannot just pop every possible commercially available probiotic into our bodies without actually knowing what's happening inside of us as well. Sometimes what will happen is that you are taking a particular probiotic, but it might not show up in the microbiome results at all. This happens because it's not just taking a probiotic, it is making sure that the probiotic sticks inside your gut, something we call the colonization efficiency in science. This is a very important factor which is missing in the research. We do not have a lot of data for which probiotics actually sticks into your gut and which just passes through it like a water through a pipe. So it is important that when we are choosing a probiotic for ourselves, we need to be looking at two very important things. One is, what if I already have that probiotic inside me? And the second is, if that probiotic has enough studies done on it for engraftment or for colonization efficiency. I think having these two questions in your mind and asking them is very important before you go on and start popping random probiotic pills at all.
Understanding our gut microbiome can help us choose a better probiotic and tackle gut dysbiosis. But how can we uncover details about our gut microbiome? The key is gut microbiome testing. This test analyzes the microbes in your gut, allowing healthcare professionals to provide personalized advice for your specific gut issues and symptoms. Gut microbiome testing involves collecting stool samples from the patient. These samples contain the gut microbes. To identify these microbes, DNA sequencing is performed, specifically analyzing 16S rRNA genes, which are unique to each species. After identifying the species, a gut microbiome report is generated for further analysis by a healthcare professional. While some gut microbiome tests only show the number and types of species present, known as the gut microbiota, this is not the full picture. To truly understand your gut health, it's also crucial to know what chemicals these microbes are producing. This additional information provides a clearer view of how your gut functions and its impact on your overall health.
So if you go for a microbiome testing tomorrow, and if they are showing you a list of species which are present in your gut, or let's say a pathogens and the probiotics, they're talking about microbiota, not microbiome. When we say things like microbiome, there's much more detail and depth of understanding of the report itself. Well, when you do a microbiome analysis per se, you will see the number of genes that are coding for, let's say, important metabolites like short-chain fatty acids, acetate, propionate, butyrate, gases like methane, hydrogen sulfide, ammonia, neurotransmitters like acetylcholine, GABA inhibitors, serotonin, and dopamine. When you start seeing terms like these in your microbiota testing or microbiome testing is when you really know that you're looking at your microbiome and not your microbiota.
Decode Age is a leading brand in gut microbiome testing in India. Their gut microbiome testing reports offer detailed information about the types of microbes present in your gut, including both beneficial and pathogenic microbes. Additionally, the test reveals the metabolites produced by these microbes, which can indicate whether specific foods are being digested efficiently and highlight any deficiencies in essential microbes. Before conducting the gut microbiome test, specific gut-related symptoms and past medical histories are collected from the patient. This step is crucial for accurately correlating the test results with your symptoms. Trained nutritionists analyze this information to identify which microbes or metabolites might be contributing to your symptoms. Based on this assessment, a nutritionist may recommend lifestyle changes and dietary adjustments to improve your gut health. In more severe cases, a functional medicine doctor might prescribe specific antibiotics or probiotics to address the issue more effectively. Gut microbiome testing provides high-resolution data that you and your healthcare professional can use to make informed decisions about your health. This comprehensive approach ensures you receive personalized advice and treatment to optimize your gut health.